Hey guys, this is Dr. Hub. Today we'll look at the hormones. So we are looking at the hormones that regulate the calcium levels. So what is it? So first is we are going to look at the parathyroid hormone. So in short we are writing it as PTH. So what is the stimulus? The stimulus for the secretion is a decrease. So there is a decrease in the calcium osteoblast. So decrease in the calcium osteoblast will lead to the parathyroid hormone secretion. So then what is the effect on the bone? The effect on the bone is it increases the resorption. So it increases the resorption. And what is the effect on the kidney? The effect in the kidney. So effect in the kidney will be the calcium. There's calcium reabsorption, as well as there's decrease in the phosphate. So there's calcium reabsorption and decrease in the phosphate reabsorption. And next is the effect on the intestine. So in terms of the intestine, there is indirectly it stimulates the conversion. So indirectly stimulates the conversion, and this is of the 25 OHD to the 125 OH2D. So how is the serum calcium? The serum calcium is supposedly it is increased in terms of the parathyroid hormone, and the serum phosphorus is decreased. So serum calcium is increased and the serum phosphate is decreased. This is in terms of the parathyroid hormone. Next we'll move on to the calcitonin. So in terms of calcitonin, what is the stimulation of secretion? The stimulation of the secretion. The stimulation of secretion, it is the increase in the serum calcium. So increase in serum calcium will lead to the increase in the calcitonin. And the effect on the bone. See, in terms of parathyroid hormone, the effect of the bone, that is increased resorption, whereas in calcitonin there is decrease in the resorption. Next, what is the effect on the kidney? In the kidney it is reverse, that is it decreases the calcium resorption and it increases the phosphate reabsorption. Then what is the serum calcium and serum phosphorus? So serum calcium and serum phosphorus both are decreased. Lastly, we look at the vitamin D. So what is special about the vitamin D? The stimulus of secretion in vitamin D is in terms of decrease in the serum calcium, as well as a decrease in the serum potassium, serum phosphate, as well as the increase in the PTH. So all this will lead to the stimulation of the secretion of the vitamin D. Next, how is the effect on the bone? The effect on the bone, it decreases the resorption. It decreases the resorption, that is the adequate calcium supply. Next, it increases the resorption. And this is going to be in terms of the inadequate calcium supply. So it has a dual role, that is it can decrease the resorption in terms of adequate calcium supply and increase the resorption in terms of the inadequate calcium supply. So how is this effect on the kidney? So the effect on the kidney we saw here, it is both are together, that is a calcium as well as the phosphate. So calcium and phosphate resorption is increased resorption. So in parathyroid hormone it was increase in the calcium resorption and decrease in the phosphate resorption, whereas in calcitonin in the effect of the kidney it is the reverse, that is there's a decrease in the calcium as well as the phosphate resorption. And in terms of the vitamin D, it is increase in the calcium and the phosphate resorption. So what we are telling is in the calcitonin there is a complete decrease in the calcium as well as the phosphate resorption, Whereas in vitamin D, what we are seeing here is the calcium and the phosphate, both they have their increased resorption. So next in vitamin D, let's look at the effect on the intestine. So how is the effect on the intestine? The effect on the intestine, it increases the calcium. It increases the calcium and the phosphate. So it increases the calcium and the phosphate absorption. So how is the serum calcium? The serum calcium, it is increased. So is the serum phosphorus. Whereas it is completely opposite to the calcitonin. Calcitonin, there was decrease in the serum calcium and phosphorus. Whereas here, there is an increase in the vitamin D.